Ravencroft resident Maria DiMartini now walks with a cane and wears compression gloves to soothe aching joints.
There's a lot of pain. There's a lot of ache. There's a lot of fatigue. There's fatigue from the disease, and there's fatigue with dealing with the pain.
The mother of two started struggling with symptoms in the late 1980s, unsure of what was wrong. In 2014, she had a severe flare.
It did attack my kidney. I had kidney disease, lupus nephritis stage 4, which was pretty serious.
After nearly 30 years of frequent pain, Maria was diagnosed with lupus, a chronic autoimmune disease.
So when someone gets an infection, your body makes various proteins such as antibodies to fight the infections. In someone with lupus, their body makes antibodies against self molecules or molecules from their own tissues, their own organs, and depending upon what their antibodies are, they end up attacking their own body. And so they have symptoms based upon that.
Jersey Shore University Medical Center's Dr. Deborah Alpert says symptoms range from mild to severe, including fatigue, rashes, joint pain, swelling, and hair loss. The disease can affect just about any organ. The doctor says blood tests aren't enough to make a diagnosis. She discusses the patient's history of symptoms, which may mimic other conditions, and conducts a physical exam.
A lot of times people initially might be misdiagnosed as having some sort of infection or having another pain syndrome or having another type of arthritis.
Although the Lupus Foundation of America doesn't have statistics for New Jersey, it estimates that nationwide 1.5 million Americans have lupus, and it says that number may be higher. Dr. Alpert says lupus is more common in women of childbearing age, although young children and older men can develop lupus as well. It's more prevalent in African Americans, African Caribbeans, Hispanics, and Asians.
There's environmental triggers, such as infections or UV light or various stressors that can take a genetically predisposed person and possibly predispose them to actually develop the illness.
Although family history is an important part of the discussion with patients, Dr. Alpert says that factor doesn't guarantee someone will develop the disease. There's no cure for lupus. Medications are used to manage and prevent flares.
Lupus is a disease that can wax and wane.
Maria is on 13 medications. Some days are good, some days are bad. She doesn't know when she'll have a flare. The symptoms